you so much for joining us today. I have the pleasure of having Dr. Kaitie with us from Move Strong Seniors. And if you guys have not joined her social network, you guys have to. She's absolutely incredible, to the point, short videos, very informative, and I just love watching her and I love what she has to talk about. So today what we'll do is we'll talk about mobility and movement, and we'll give you some tips and tricks. And so, but before I start off, I want to introduce Dr. Kaitie. Thank you so much for joining.
Thank you so much, Erica. I'm super excited and super thankful to be on here today with you. I'm Dr. Kaitie, like Erica said. I'm the founder of Move Strong Seniors. I'm a concierge physical therapist, so by trade, I do treat people in the homes and their houses, but I also have a growing social media platform on Instagram, YouTube, TikTok, Facebook. I'm on all of them, but I'm super happy to be here and I'm super excited.
Yes, thank you so much for joining. Yeah, so definitely, again, if you are not already connected with Dr. Kaitie, join her social network. Tons and tons of information. So before we get started, I just kind of want to get a feel for your ideal avatar, right? Who is your ideal client? Who do you normally service? And then tell us why. Where are they coming from? What's their stories? What's their background?
Right. So this is a great question. And truthfully, I could see anyone, right? Every person, and I'm a diehard fan of movement and therapy, but everyone has a reason, everyone has a purpose. All of us need movement. We all need to exercise. But I will say my ideal client is someone who's trying to stay independent, trying to stay mobile, trying to stay active. Maybe they don't have anything wrong with them at the time, but they're trying to prevent and help themselves commit to their health. That's the ideal person. Someone who's motivated, someone who wants to be there, who wants to get better, wants to feel better. That's the ideal person. Where they come from, they can be all different backgrounds. My background, I worked at a hospital, so I worked in the outpatient sector. So I saw everything and anything. It could be a twinge in the low back. I saw spinal cord injuries, I saw brain injuries, stroke patients, you name it, I probably saw it. Basically, I started my business because I wanted to almost bridge the gap between going to a traditional clinic and also people that just need exercise and movement. And no, I'm not a personal trainer, but I do find that there's a gap, and there's always that gap in healthcare. But the gap of insurance may be saying you have X amount of visits and you can only go for that amount of time. They discharge you, you have a break. Typically, most people don't keep up with their exercises. You decline, you go back a little bit, and they end up back in therapy. I wanted to bridge the gap of maintaining because insurance typically doesn't cover maintenance. So that's kind of where I come in, is just benefiting for the longevity, for health, for wellness. And that's where I want to dive into. And the social media, every single day I post strength, balance, grip strength, everything, all of it, so that you have simple little tricks. But really anyone and everyone could benefit from movement.
Love it. I love that. And I love your name. And I love that you have seniors in your name.
Yeah.
Why specifically seniors? I mean, obviously, you know, that's like my love and joy and my happy place. But tell me about you. Why seniors?
So also, I kind of fell into this avenue. I knew I wanted to do something in healthcare growing up. I wanted to be a doctor, like a true medical doctor, but I can't do needles and I can't do blood. So I didn't think I'd make it too far. But growing up, I worked at Publix. My family is Publix diehard fans. And I always found, like, even just when I was a cashier, I could always connect with people who were older than me. Like when they came through the line, I could have a full conversation with someone who's older than me. Someone my age, I was like, don't talk to me. So I just always had this weird connection. And then once I knew and found physical therapy, I was like, I love health. I love the gym. I love helping people. So it's basically the best career for me. And then my mom had a couple back surgeries. There's always something that kind of gets you into it. My mom had a couple back surgeries. I went to her PT. I saw the environment. I knew it wasn't what I wanted at that clinic, but the vibe of the therapy was what I wanted. Naturally, as people get older, like even I'm still young, we're still young. Everyone is still young in their own way. As we get older, I'm trying to do this for myself too. Like, what can I do now to help myself later? But it's never
100%.
too late. Like even my 80-year-old, 90-year-old, 98-year-old patients, like it's never too late to start. It's just, you got to find the time and you got to be wanting to. But I do love my aging population.
Yes, I 100% agree with that. So talk to me about maybe some of the biggest physical challenges that are out there that are maybe overlooked, and how maybe that could lead to some challenges as we age.
Right. So this is a great question because everyone always wants to know, like, what can I do as I get older to prevent falls and stay strong? I would say the biggest physical challenge, and it might not even be physical, but it's mental, is people's confidence. Like as we lose confidence, we just naturally don't move as much. So when people start to get scared, they have a near fall, they start using furniture to walk, they're not going to move as much because they don't feel like they have the strength, the motivation, the confidence to do so. So I feel like that's honestly one of the biggest challenges. And there's so many ways, maybe not someone saying, I lost my confidence, but there'll be little signs here and there that someone is starting to decline. Those first warning signs are when someone should take action, because people usually wait until something happens to get the therapy or to start moving or exercising of the sorts. I think that's honestly, like, confidence is probably the biggest challenge that people start to face as we get older.
That's really interesting. So you're saying to families, look for these things within your loved ones. If you see that they're using something else for their confidence for mobility, start paying attention to it and then maybe seek help then.
Right.
So don't until the body becomes fatigued to maybe do some of these things.
Right. And naturally, I mean, just in our healthcare system alone, it's a very reactive environment. So you fall, you get therapy. You get a surgery, you do therapy. There's not many people that are like, oh, guess what? I'm doing this because I want to be a healthy adult when I get older, right? So that's the gap that I'm trying to get to, is because what we do in our 50s and our 60s directly impacts how we're going to be when we're 80 and 90. So it's starting before it's an issue that a lot of people are missing that gap in healthcare.
I agree with that. Yeah, I mean, 1 out of 4 adults fall every single year. That's a massive statistic. And so knowing that, what part of our body would you recommend we concentrate on? What, like, is it more upper? Is it lower? Since falls is such a big thing, what would you recommend?
Yeah, such a heated topic because I could go on and on about what's most important. But honestly, our legs, our core, and our ankles, surprisingly. So our balance starts at our feet. We're standing typically when we lose our balance. We could be seated, but most of the times we're standing. Our ankles have so many ligaments, so many muscles, so many layers of muscles that people neglect. I'm not going to the gym to work out my ankles. I haven't heard of one person, unless you have an ankle problem, that you're going to the gym to strengthen your ankles, right? But our ankles, just the sensation of our feet being flat on the floor, our brain sends signals. Can I feel where my big toes are? Can I feel where my heel is? Can I feel everything? A lot of people as we age start to lose that sensation. So when you lose that sensation, your balance goes because you're not feeling where you're walking. So our ankles, our reaction time, if someone were to come push me from behind, at my age, my reaction is I step forward, I put my hands out. As we get older, that reaction time significantly decreases. So if our reaction time is decreased, if we can't feel our feet as much, our balance is obviously not going to be as good. And the biggest thing with balance is that it can be practiced. A lot of people are like, oh, my balance stinks. I'm done. I can't do anything. But it's just like a muscle, and the fact that if you train your brain, you train yourself, you practice every day consistently, it will get better. There's no reason it won't, right? I think that our ankles and then obviously our legs are just super dominant. Having our legs be strong can clench us and be able to keep us on our feet a little bit longer. And then again, our core, because if our core is wobbly, if our core is weak, we're going down no matter what. Honestly, I think legs, core, ankles, the biggest focus, but you could always argue upper body too, because most of the time we are reaching out if we fall. But again, most likely, if we are going to reach out, some people, I see a high incidence of wrist fractures because you're putting all your weight on your hands. Yeah. So the whole body's involved, but there are like significant, obviously your legs are much stronger and bigger muscles, like composition wise, than your upper body. So keeping those big muscle groups strong is super important.
Excellent. And then do you have like 1 or 2 exercises that you would recommend at home that someone can, I know you have tons of exercises, but something that you would recommend, like if you were to do one thing, do this every single day and this would help?
Yes, I swear by sit-to-stands. They're my favorite exercise. I could give you every single organ system of the body and how a sit-to-stand reacts to that. But just alone, obviously strengthen the legs to stand. We need our balance to keep ourselves steady when we stand. We have to think about it, mind-muscle connection, so there's some coordination involved. Everything we do, our quads, our hamstrings, our glutes, our calves, everything is working, our core. So simple, and so many modifications too. Like if you need to put your hand on a walker, you put your hand on a walker. If you need someone to help you, you can have someone help you. But the more repetition you do is super important. That alone, we have to do it when we stand up from a toilet, when we stand up from a chair, when we get out of bed. Like you're doing it automatically. But yeah. I use those opportunities, especially, I call them like exercise snacks, is when you're standing on the toilet, do it 2 times. When you're getting up from the chair, do it 3 times. So you break it up throughout the day, and it becomes a lot more doable. But you're going to have to be able to stand, unless, I mean, there are people that are completely bedbound, and that's okay. It's people's scenario. More likely than not, we're going to have to do it at least maybe 2-3 times a day. So then just making it an exercise makes it almost like functional, realistic, doable.
Yeah, I love that. And you don't need to get equipment to do any of this.
No.
It's a chip and it's you.
Yep.
And so everyone should be able to do that. And then to your point, the snack, I love that analogy. That's so cute. Yeah, like if you do it once, do it twice, do it 3 times.
Yeah.
And get that in there. I love that.
Yeah.
Okay, amazing.
Yeah.
And then what are some things that like can falls be preventable? I know that we talked about like strengthening your bodies. Mm-hmm. And so, and having the right support there. But do you feel like that's something that could be preventable at all or no?
So yes, they can obviously be preventable, but I think that we have to practice all the foundational things first. So if someone, and I post a lot on my social media about fall recovery, getting on and off the floor, if I were to fall, or even if I'm just playing with grandkids or gardening or reaching for a pot on the floor. It doesn't need to be a fall. It doesn't need to be traumatic. You can purposely get on the floor. And I have so many people that they're like, that's totally impossible. There's no way I can do that. But then I post other alternatives, and I've had people reach out to me and say, oh my goodness, I have not been able to do that in 50 years. And I just did that for the first time. And that's amazing. So it's like, there are ways to prevent it. And I think the biggest thing is practicing. And maybe you're not strong enough to like get on and off the floor. Maybe it has been 30 years since you've done that. And like today is not probably a great time to practice that, right? But we need to start somewhere. So strengthening the legs, working on our balance, working on reaction, working on all the things. Movement alone can change their whole perspective on life. Like it's so, and I obviously am biased, but like movement is literally medicine. And people that don't do it, like you obviously are putting yourself in a position to just decline and decline and decline. And it doesn't need to be aggressive. Like I'll literally say, practice something twice. And then guess what? That's more than you did yesterday. Like there's no standard to it. There's always those people that say like 10,000 steps a day, like all the things. Base it off what you're doing. Give yourself a little goal. And then, falls can be preventable if you practice all the pieces that make it preventable, So it's a hard topic, but there are ways to work your way up. And it's never too late. It's never too late.
I agree. And I do think that something is better than nothing. So the goals of having 10,000 steps a day, it almost seems like, okay, I'll start that tomorrow. It seems overwhelming. So start with the little things, start with the basics, start doing anything, because anything is better than nothing. So I 100% agree with you regarding that. And then, so we talked about indication of decline. What if it's someone that has care at home? How does that integrate? Like, how can a caregiver help with mobility? What are the things that, you know, they could also help with on a day-to-day basis with somebody that is seeking care, but we want to get them stronger? What does that look like?
Right. So this is also a really great topic. And I think a lot of it actually goes under the radar, because when people hire a caregiver, you're hiring them to give care, right? That's literally the definition. When you do that, and I see this with my own family, you expect them, not expect, I don't want to say expect, but almost assume they're going to start, you know, making your food for you, doing your laundry, cleaning up the house.
By the way, our kids do that.
Yes, all the things that they're assumed to do.
Yes.
But guess what? From my perspective, you're taking away their independence, right? So it's not that you're taking away the independence, but if someone asks for a glass of water for their patient, their client, walk with them to the kitchen, have them get their glass of water, then you walk them back, right? So there's a difference between, oh yeah, I'll just go grab that for you, or yeah, I'll put your shirt on for you. Let them get to the point where they're struggling, and then we provide the extra care. Sometimes caregivers are just spouses or family members. I think that also plays a part, is because you just want to love them and care for them and do everything you can. They appreciate it. Even if they don't say it, they appreciate it, and we know that. But from the physical aspect, I find a lot of times it does put a damper sometimes on their independence, because also it's quick. Guess what? I have an appointment at 12 o'clock. It's 11:45. We got to get out the door. I'm helping you put on your shoes. I'm helping you get dressed. But again, from a PT perspective, give yourself time. You have an extra hour in the morning. Prepare for that. You know it was coming, unless it's like some surprise thing, but prepare for it. And then you have time to let that person be independent, even if it takes 3 hours for them to shower, get up, get dressed, have breakfast, but you prep for it. And that morning became part of it. But I think that that alone is something that caregivers can definitely use just as a piece of advice. But I also like to, especially when I have patients that have caregivers, I will spend time, even if it's an entire session, teaching them what I'm doing. Because there's no better thing than the carryover, and me being there twice a week, 3 times a week, it's not enough. It's good, it's great, it's better than nothing, but you have to do other things throughout the days that I'm not there, or even if you're not getting therapy, just movement every day. Teaching the caregiver, because a lot of times patients are not they're not gonna initiate it themselves, be like, let's do our exercise. So if the caregiver's like, hey, we just had breakfast, we're going to give yourself 30 minutes to digest, and then I'm going to help you do, you know, some stretching or some exercises. Yeah. So I've actually made programs, hung them on patients' fridges with check boxes for the caregivers, and with like initial boxes, so you could see if the wife did it, if the caregiver did it, if the patient initiated it. That way we keep the whole team accountable, and you just check, check, check. I give them literally, and I'll sit with them, do their schedule. 9:30 they wake up, they eat breakfast, they do this, their exercise, check. So it's set up for them so that they have that based on their schedule. So I like to keep them accountable.
Yeah. And I love that. And that's exactly it. It's accountability. So one thing that you do is, and you said, is we merge that into our 𝗧𝗵𝗶𝘀 care technology. Right. So exactly what you're saying, those protocols. So, okay, so maybe if it's not that cup of water that they're getting, there should be an assigned time allocated to be doing exercises. And I want to talk to you about when you feel that time would be best to do. Mm-hmm. But what we do is, based on your protocols, we basically have that we input into their technology. So now it becomes part of your daily plan.
Right.
And we can also add your videos in there. So if there's a specific video that the caregiver maybe took with them, something that's specific to them, maybe them doing it, we input that into their technology. So, and then we set a reminder that aligns to that to say, hey, our protocol at home, you see Kaitie Monday, Wednesday, Friday, Tuesday, Thursday at 9 a.m. in the morning, there's a reminder set with that protocol of what it is that they need to do as far as exercising. Yeah. And there's a video that goes along with it. So now we are doing all these things at home with the caregiver. There's accountability. There is a report that is sent to see what we've done and how we've done it. and it all aligns with what you're talking about doing at home. So I do think that a physical component of all of this is so important, and like it's catered to the person. Like some people may be able to do all these things, some people may need to be able to get the help that they need in some of these ADLs, the daily activities, but that whatever component of movement, to your point, is so necessary, whatever stage, to try to get people into that, you know, physical, but also mental better state as well. So I love that.
Yeah. And I think too, that's also the beauty of being in people's homes is you lack that component when you're in a traditional clinic.
100%.
If Sally Sue tells me I can't get up from my couch, I'm like, okay, well, how tall is it? Can you take a picture? Can you measure it? I'm in the house. I can literally do everything that they're limited with them, take a video, show the caregiver, show the spouse. It is gold to be in someone's house, because especially as we age, we're in the house, unfortunately, a lot more than we probably were. So being in that environment, you know, the ledge to the shower, going on the balcony, getting in the car, all of the things we're limited with, you can't really replicate as much as you want to in the clinic. So I think that's also the beauty too of being in the home with them, with the technology, all of the things included, for sure.
And it's customized to them. I always say, even a facility, it's customized to the facility. Being at home, whatever it is that you're doing is customized to you. So your PT is customized to you with the things that you have around the house. That's your things that is customized to what you need to do with those things. And your care is customized to you, and your exercise that you need to be doing, and, you know, nutrition and all that stuff, everything is tied into you. So when you are at home, it's more of a personalized approach than when you're in a facility setting, to where you kind of cater yourself around their programs and their things.
Yeah, there's no cookie cutter patient. Like I will never give two patients the same thing, because no two people are identical, and no two people have the same impairments. So exactly what we said.
I love that. I love that. Okay. So if somebody is looking to seek your care, where do they find you? When are they ready to come to you? Talk to me about that.
When they're ready, whenever. I'm ready when you're ready. To find me, though, the best way to contact me is through 𝗍strong_seniors.com. I have an in-person and a virtual. The only limitation, unfortunately, is that I can only see people in Florida. So that, I think, for you too, mainly. But South Florida region, there's an inquiry form, so you can fill that out, and then I'll call you probably within the next 30 minutes or so. Or you can contact me via email. So it's Dr. Kaitie, Kaitie, at 𝗍strong_seniors.com. So that's the simplest.
Information.
Yeah.
Perfect. And we'll add all your information at the end, so then everybody can have your information and reach out, and your socials, which
that's also such an easy way. Yeah.
So even if you are not ready, but you think that there is value to this, please join her social network, start watching her videos, start watching her style, and then get a feel for her. And then when the time allows, when you're ready, I highly recommend you do a consultation. She's absolutely incredible. And actually, part of her modules are embedded into our technology. And so, yes, and they're catered to you. If there's something that you see that she's doing, or a session that you're doing with her, we will then take that and put that into the system, so you have that permanently for you to look at your leisure. So want to thank you so much for your time. And to those that are watching, we hope that this has been super valuable to you. So thank you so much. And so if you have any questions, feel free to reach out. Thank you so much, Dr. Kaitie. And we'll talk soon.
Thank you.
Bye, everybody.